A brand new veterinary medication is entering the global market for dogs suffering from severe allergies and chronic itching. It's called Zenrelia, and many pet owners have never heard of it. That's because it's extremely new. The drug was first approved in the United States in September 2024, and it is only now being rolled out across Europe and other international markets. But with its arrival has come both excitement and caution from veterinarians and dog owners alike. So what exactly is Zenrelia? Who makes it? How does it work? And are there any risks you should know about? Let's break down the facts. What is Zenrelia? Zenrelia is a veterinary prescription medication for dogs used to treat allergic skin disease. Specifically, it is approved for pruritus, severe itching, associated with allergic dermatitis, atopic dermatitis caused by environmental allergies, chronic inflammatory skin conditions in dogs. The medication comes as a film-coated oral tablet and is typically given once daily. It is approved for dogs 12 months of age and older. Who manufactures Zenrelia? Zenrelia was developed and manufactured by Elanco Animal Health, a major global veterinary pharmaceutical company headquartered in the United States. Elanco produces a wide range of veterinary medicines, including parasite treatments, vaccines, pain medications, dermatology drugs. Zenrelia contains the active ingredient ilunocitinib, a molecule specifically designed to target allergic inflammation pathways in dogs. When was IT approved? Zenrelia is one of the newest medications in canine dermatology. Key regulatory milestones include September 2024, approved by the U.S. Food and Drug Administration, FDA, for treatment of itching and atopic dermatitis in dogs. 2025, received European Commission approval for use across EU member states. Following that approval, the drug began rolling out to European veterinary markets, including availability expected in the United Kingdom by late 2025. Because of this timeline, many vets and pet owners are only just starting to encounter it in clinical practice. How does Zenrelia work? Zenrelia belongs to a class of medications called Janus kinase inhibitors, commonly referred to as JAK inhibitors. These drugs work by blocking signaling pathways inside immune cells. In dogs with allergic skin disease, the immune system produces inflammatory molecules that trigger itching, redness, swelling, skin lesions. Ilunocitinib blocks specific cytokine signals involved in allergy and inflammation, interrupting the itch-inflammation cycle. This can significantly reduce scratching, skin inflammation, allergic reactions. However, because the drug works by suppressing immune signaling, it also has immunosuppressive effects, and that leads to the most important safety considerations. Safety warnings and side effects. When Zenrelia was first approved, regulators required strong safety warnings on its label. One key issue involved vaccination timing. The FDA warned that dogs should not receive vaccines within 28 days before or after taking Zenrelia due to concerns about immune suppression. In early studies where dogs received vaccines while on the drug, rare but serious complications were reported, including vaccine-related disease, pancreatitis, infectious intestinal inflammation, LIVER inflammation. Because Zenrelia dampens the immune response, veterinarians must carefully evaluate each dog before prescribing it. Reported adverse effects. Like all medications, Zenrelia can cause side effects. Some of the issues reported during clinical studies or post-approval monitoring include infections due to immune suppression, digestive problems such as vomiting or diarrhea, pancreatitis, liver complications, reduced immune response to vaccines. It's important to emphasize that most medications affecting the immune system carry similar risks, and veterinarians typically monitor patients carefully. Additionally, as of 2025, the FDA reviewed new data and updated parts of the safety label after additional research. However, because Zenrelia is still a very new medication, long-term real-world safety data is still accumulating. How effective is it? Clinical trials have shown promising results. In one major study involving 338 dogs with atopic dermatitis, Zenrelia provided significant itch relief and clinical improvement compared with existing treatments. The medication was also shown to be at least as effective as other JAK inhibitor drugs used for canine allergies. For many dogs suffering severe allergic itch, this could represent an important additional treatment option. Is Zenrelia used in the UK? Yes, but only recently. Following approval by the European Commission in 2025, the drug began rolling out across European veterinary markets, including the United Kingdom. Because the approval is so recent, availability may vary depending on veterinary clinics, supply chains, prescribing practices. Some veterinarians may also choose to wait for longer real-world safety data before using it widely. Zenrelia is a new oral medication for dogs with allergic skin disease, manufactured by Elanco Animal Health. Approved in the United States in 2024. Approved in Europe and the UK in 2025. Contains ilunocitinib, a JAK inhibitor immunomodulator. Works by reducing immune-driven inflammation and itching. But like many immune-targeting medications, it also comes with important safety considerations. Because it is still very new, long-term data is still being collected. Disclaimer: the purpose of this video is educational. If your dog has allergies or skin problems, always discuss treatment options with a qualified veterinarian before starting or stopping any medication.